Now, in our second section, we will talk about very important disease and how it can affect the pregnancy. So let's talk about chronic kidney disease in this section, and we talk about the stages of the kidney disease and what are the effect of chronic kidney disease or renal disease during pregnancy and how the patient can be monitored. First, the stages of chronic kidney disease. These are the 5 stages of chronic kidney disease. If we see here in the first stage, the kidney damage with increased glomerular filtration rate, so normal or increased. Glomerular filtration rate in the first stage may be normal or increased. Glomerular filtration rate is above or equal to 90%. Diagnosis and treatment of underlying condition is important in stage 1 chronic kidney disease. So initially in stage 1, glomerular filtration rate is increased or normal, and usually it's more than 90%. Then in the second stage, it's called the mild stage of the kidney disease or chronic kidney disease. In this now, the glomerular filtration rate is from 60 to 89. So 60 to 89 is glomerular filtration rate, and estimate the rate of progression. It's important at this stage, which is the mild stage of kidney disease, we should look closely about the progression of the disease. So if it's progressing very fast or if it stops at that stage or not. Third stage, which is known as the moderate stage, here we have glomerular filtration rate from between 30 to 59. Evaluate and treat if there are any complications. Then in the fourth, it's a severe stage. Glomerular filtration rate now it's get from mild to severe. It's becoming less and less and less, and now glomerular filtration rate is from 15 to 29. Prepare for renal replacement therapy now at this stage. And then in the fifth stage is the kidney failure, and glomerular filtration rate is now very low, less than 15, almost none. And this is the stage where dialysis is required. Dialysis or transplantation if uremic. If patient is uremic or uric acid level is high, then they should start dialysis or transplantation of the kidney. So these are roughly the 5 stages. In the first, normal glomerular filtration rate or increased. Then in the stage 2, mild. Then we have moderate, severe. Glomerular filtration rate keeps on decreasing, and then in the final stage, when it gets lower than 15, this is the stage when they need dialysis and then renal transplantation. These are the stages of chronic renal disease or kidney disease. Stage 1 and 2 affect 3% of women of childbearing age. Stage 3 to 5 affect 1 in 150 women. So 1 and 2, 3% of all the women in childbearing age. 3 to 5, they affect 1 out of 150 pregnant women. So it's not that uncommon that patient during pregnancy have chronic kidney disease. Now let's go over the effects of chronic kidney disease on pregnancy outcomes. Usually there is increased risk of preterm delivery, and delivery by C-section is recommended. And then fetal growth restriction is also present in patients who have chronic kidney disease. This is a chart that shows the effect of mean pregnancy serum creatinine value. If the creatinine level is increased or creatinine clearance get lower and lower, and the creatinine level gets increased in the serum, it has effect on the outcome of the pregnancy. This is a chart that shows the difference between if the level is less than 125, from 125 to 189, and then more than 180 or 189. So as the serum level of creatinine increases, it has more adverse effect on the outcome of the pregnancy. So fetal growth restriction, if you see if the creatinine level is more than 180, the percentage of fetal growth restriction is up to 65%. Preterm delivery is more than 90% if it's above 180. Similarly, its preeclampsia is 60% if it's more than 180. About 25% loss of more than 25% renal function occur in women if they have above 20% women postpartumly or postnatally, if they have high serum level between 125 to 189 and then above 180. Similarly, about 2% of women whose serum creatinine level is between 125 to 189, they have renal failure after 1 year, and 35 women, they have renal failure if the creatinine level is above 180. So all these are the effects of kidney disease on the outcome of the pregnancy. Next, monitoring of the patient with chronic kidney disease. Very important that the blood pressure should be monitored on very regular daily basis. Urine infections and proteinuria should be monitored. Full blood count, hemoglobin level and ferritin level should be monitored, and then renal ultrasound should be performed on regular basis to find out the condition, or kidney function test should also be monitored. Then we have a fetal ultrasound, anatomy, uterine artery Doppler 20 to 24 weeks of gestation, and then also monitor the growth of the fetus very closely. Then renal function test and creatinine level should be monitored to find out what is the level of serum creatinine. In the previous slide, we went over the effect of the serum creatinine level on the outcome of the pregnancy. So renal function test and creatinine levels should be regularly monitored. So all these things are important for monitoring the patient who is pregnant and have chronic kidney disease. Dialysis is end-stage renal disease when it is reached when glomerular filtration rate is less than 15. Then the patient requires dialysis or transplantation. Hemodialysis is the preferred method to do the dialysis. Hemodialysis is more effective, and then dialysis must be adjusted to allow physiological changes of pregnancy. In this diagram, you can see this is the dialysis procedure, hemodialysis. One needle withdraw the blood, and then it goes through the dialyzer machine and it cleans the blood of any waste products, and then the clean blood then comes back to the body. So that's how the dialysis takes place. Its purpose is to clean the blood of any waste products that are accumulated in the body as a result of kidney failure. So hemodialysis is more effective to do. Complications of dialysis, preterm delivery can occur, and then polyhydramnias. Polyhydramnias is a condition in which increased amniotic fluid is present, so polyhydramnias can occur also. Then preeclampsia, C-section delivery is performed in patients with end-stage renal disease and who are on dialysis. Then pregnancy in women with renal transplants. Women with end-stage renal disease, hypothalamic gonadal dysfunction is present, and usually patients who are or women who have end-stage renal disease, they usually have infertility. Conception is hard. They cannot conceive if they have end-stage renal disease because of hypothalamic gonadal dysfunction. Hypothalamic pituitary ovarian axis is must for the conception, because we talked in detail about this axis, that hormones are released from the hypothalamus that act on the pituitary gland, and then they produce hormone which affect the ovaries and the testes. Without this proper function, fertility is not possible. So because of this dysfunction, infertility occurs. Then successful pregnancy outcome after transplantation. So after transplantation, the outcome of the pregnancy is successful. Monitoring of renal transplant patient, again the same thing which were for the patient with chronic renal disease. Blood pressure should be monitored, drug levels should be monitored, full blood count, hemoglobin, ferritin levels, renal ultrasound. Then if renal function decline, exclude any obstruction, infection, or rejection of the transplant. Any transplant have the chances that it might get rejected by the body. So if the any renal functions are not proper and they are declining, then look for any rejection of the transplant, or if there is any infection or obstruction. Then also renal function test, which include creatinine and polyuria, proteinuria. So all these are the different tests that should be performed in patient with renal transplant and pregnancy. So that was all about this section. Thank you for watching sqadia.com.